Hello, my name is Stephen O'Connor. I'm a staff attorney with the National Health Freedom Coalition and National Health Freedom Action. Today is January 24th of 2026, and we're going to take a look at some common issues that come up with hospital consent forms. And so if we all could just hang on a second, I can share my screen. So first off, I just want to mention some vocabulary about consent and versus informed consent. They are two different ideas, but they're often used interchangeably in the context that we're looking at. So it's important to keep in mind for other purposes that they are different. Consent being your basic right to say yes or no to a medical treatment, whereas informed consent is more of a methodology to ensure that uh, doctors are able to protect themselves legally and that patients understand what their choices are. The two ideas do overlap in that any kind of consent requires some information, like such as what is it that I'm consenting to or declining. And also, informed consent works as a mechanism to prove actual or simple consent. So they do overlap, but they're often used interchangeably in this context. So for today, we're going to use them somewhat interchangeably, but it's important to keep in mind that those are different ideas. So the American Medical Association talks about informed consent as fundamental in both ethics and law, and that this idea requires doctors to disclose a person's diagnosis, risk of treatment, benefits, and alternatives, which should always include the alternative of not doing anything. There's case law in different states about informed consent, and they talk about the idea that it protects against battery, because if someone is touching you and you have not specifically authorized it, that can be a battery. So protection against allegations of battery, and also protection against allegations of negligence for failure to disclose a material risk. So you can't make an informed decision about, for example, a surgery if you're not told that there is X% chance of some bad outcome that is described. And so states basically have most of the law regarding these informed consent obligations. Um, Now, interestingly, hospital admission forms obviously are forms, and they're always in writing. But technically speaking, written consent for medical care outside of that context is generally only for things like surgery, mental health treatment, or other sensitive issues. So on some more minor issues in most states, you could consent verbally to a particular action with a doctor. And then the statutes or the laws and the cases, which is the legal opinions, vary around the United States. So the hospital forms can be somewhat different for each state. And other authorities underlying these forms, the AMA guidelines that we talked about, and also there are rules from the Centers for Medicare and Medicaid, and since pretty much all hospitals accept that type of funding, that is a national tie-in that gives some guidance and requirements for the hospitals. Types of forms. There's often going to be a general consent to treat, which would authorize routine or minor medical care. Now, if we look at the packet in general, we have, generally speaking, you're going to get a packet with consent to treat, financial consent, HIPAA acknowledgement, patient rights, arbitration, and consent to media such as photography. And arbitration is important because basically what that is you agree that you give up your right to sue in a court where a jury would decide, for example, if a hospital is negligent, and if so, how much damages should you be awarded. You're giving up that right to go to court and have a judge or jury hear your case, and agreeing that if you have a complaint or a claim against the hospital, it would proceed by private arbitration, which is where a professional arbitrator would basically meet with everyone in their office and hear both sides and then make a decision. And oftentimes juries are more generous when it comes to finding fault with professionals, and also more generous when it comes to damages. So it is a very strong benefit to a hospital to have you sign away your right to sue them. Now, in California, as a side note, in a couple decades back, a court of appeal in California held that an arbitration clause that's not properly explained can be what we call a contract of adhesion or an unlawful contract. And then subsequent to that, the California legislature went back and undid the case with a specific law that says a, quote, properly drafted arbitration clause for medical care is statutorily defined as not a contract of adhesion. And we'll see a little bit more about what that means in a moment. And there are also procedure-specific consent forms for surgery, other invasive procedures, and these have to contain the risks, the benefits, and the alternatives for the proposed surgery or other treatment. And once again, we always need to have included the option of not doing something. There is no single nationwide form because state statutes and case law is different. So each hospital system or hospital drafts these agreements using the state law along with the federal guidelines that we talked about. Now, some common problems with our current consent forms include that there are readability problems. They're often written at a college level of reading comprehension, which not everyone has. Not every prospective patient has that reading level. So that is an issue that needs to be addressed. In general, they're often too long, which obviously the longer they are, the more bulky, the less likely that someone is going to read each word and comprehend each word prior to signing off. There's time pressure because you're trying to get admitted to the hospital, so clearly you're eager to get some treatment for an injury or an illness. And then there are questions of capacity. Folks coming into the hospital once again are, they're not feeling well. Often that constitutes duress. They're in pain. They may be sedated. And in that situation, they don't think that they have a choice. Often folks are told to just sign here without a real conveyance of key information. Now, these forms often bundle up financial liability, arbitration, recording, as we talked about, and blanket authorization for different procedures. We'll see that in an example. And once again, possibly being a contract of adhesion. And so a side trip I want to just touch on is, what is a contract of adhesion? That's basically where one party has disproportionately more bargaining power than the other, such that the party with less power couldn't really negotiate for a variation. These are generally prepared entirely by the party with the superior bargaining power and then offered to the other person as like, here, take it or leave it. And so it's something to keep in mind when evaluating these agreements. A HIPAA case study specifically from Indiana, but it pretty much relates to every state. So the federal HIPAA rules allow hospitals to share your personal health information with other providers without a separate patient authorization. And Indiana law and other state laws allows providers to disclose your health record information to another provider, which is the idea of these health information exchanges, is to that a doctor who sees you after some other doctor would be able to look at their records. But they can also share with what we call a data aggregation association. And so an example is the Indiana Health Information Exchange, and it's the mechanism for hospitals and doctors to share clinical and claims information. These consent forms allow data to go to the Indiana Health Information Exchange, and then from there, the laws in almost every state allow for public health departments to then receive information from the exchanges. So we have to ask a question, which is a little frightening: is does this make folks patients of their public health department, and is that appropriate? Another case study I want to look at is the University of Texas Medical Center, their consent for admission to the hospital form. And we're just going to look at little parts of it that I wanted to discuss. So here it notes that you're consenting to procedures and services that may be performed, up to and including medical or surgical treatment or procedures. So here you're being asked to consent to unknown procedures up to and including surgery prior to even getting into the hospital and knowing what is recommended or all the information required. So it's really inappropriate that they would ask for that broad of a consent at the time of admission versus prior to doing a surgery or a specific procedure. They also state that in their contract that medical devices or supplies have no warranty that they actually are any good and are provided as is. And this is inappropriate because in products liability, anybody that distributes a product has some obligation and some liability if the product is unreasonably dangerous. But to say that something is as is sounds more appropriate for like a used piece of clothing versus your health care. Another case study I want to look at is the Los Angeles County Department of Public Health, their conditions of admission for inpatient. And once again, agree that to procedures and treatments, so there's that same idea of consenting to procedures when you don't know what they are yet. But one important issue is that it states that you agree that the hospital or clinic can use and get rid of, quote, use and get rid of, which is really use or get rid of, any tissue, organ, matter, or other item removed from a person's body. And this creates numerous problems. It's illegal in the United States to sell body parts and body tissues. But at the same time, it is legal for a hospital, for example, to provide organs or tissues to researchers or other parties with generous compensation for the services involved in transferring and obtaining the tissue or organ. So even though technically they can't sell the tissues, they can charge so much for services that it effectively works the same way, and there is profit in your body tissues. So with this type of consent, a hospital can effectively, even though they don't use that word, sell your body parts and tissues. And one example is that in newborn heart surgery, often it's necessary to remove a part of the thymus gland. And so we want to ask if there's a financial incentive to remove the entire gland or to take out more tissue than necessary. And do we want to have hospitals with the financial incentive to obtain more of your body tissues? And is it fair that you don't get some of the profits that come through here? And also, many folks ethically don't feel comfortable with their body parts or tissues being used for purposes other than that they should be disposed of in a respectful manner and not shipped around and studied. So here's another HIPAA case study, St. Joseph's Hospital in Arizona, and that's part of Dignity Health. And so that has the statement that your written authorization to release information is required unless we are allowed by law to disclose the information. So this turns us back to these health information exchanges. The entity in Arizona has been in existence since 2007, and if we look at their website, they note that they're a trusted health information exchange partner. They connect the Dignity Health record systems for healthcare providers so that providers can have the information regardless of where the patient goes for care. And they talk about their mission being to advance wellness and health through the delivery of actionable information and analysis. And so what this means is that, once again, your personal health information is going to be shipped off to a health information exchange, like a clearinghouse or database, and from there the law allows it to go to public health departments who are not, not your doctor, and so in my opinion, it's inappropriate. So some closing thoughts. As I mentioned, the time to think about these hospital consent forms is now, before you or a loved one needs to go to the hospital. One thing to keep in mind is that they're often going to be presented to you on a tablet or a computer screen, and it's really important to ask for a printed copy so that you can actually see the whole document and to digest it in an easier fashion than trying to scroll around on a tablet. Now, these consent forms, ultimately, they're contracts between you and the hospital. So under general contract law, you are allowed to cross things out on a proposed contract, add limitations or conditions, or on the actual document, or draft a separate limitations letter or memo that you reference on the actual document and attach it there too. Now, outside of an emergency, a hospital could refuse your admission, if the modifications you're making leave them feeling like they're not going to be allowed to follow their own protocols. But it is always something to keep in mind because these are regular contracts. Now, patient education on all these issues is needed, and also it would be helpful to have some new laws making more clear what rights we have to opt out of different things, such as the information exchanges or photography, arbitration, etc. So with that, I want to say thank you so much, and you have a great day.